Hello, good afternoon, everyone. This is Mei Hong from the Chinese Culture Connection. Thank you so much for attending the program this afternoon. It is our great pleasure to have two wonderful doctors, actually they are husband and wife, able to join us. So I would like to first introduce Dr. Liliana Ramirez Gomez. Am I pronouncing your name correctly?
Yes.
That's okay. You can introduce yourself again. So she's a director of the Neurological Study Multicultural Alzheimer's Prevention Program at Massachusetts General Hospital. And she's also instructor of a neurologist medical school. And her husband, Felipe, Jain, director of Healthy on Aging Study and Depression Clinical and Research Program at Massachusetts General Hospital, assistant professor of psychiatry at Harvard Medical School. It is an incredible opportunity for us to be able to listen to both really incredible doctors that have such a wonderful research and experience to share with us about their finding and what we can preserve our memory, which is really a huge issue in our modern time. And I don't believe that memory issue is only the pertaining to the people with the aging. I think a lot of younger people also suffering from a lot of a situation because we have a lot of information overload. So I welcome both doctors to help us to learn and understand how we can become healthier and keep our memories, particularly the good ones. Thank you.
Well, thank you very much, May. Thank you for that kind introduction. I would like to say that my wife and I, Dr. Ramirez Gomez and I, we really feel quite at home presenting to you today. And that's because our two children have been in the language programs offered by the Chinese Culture Connection for the past 3 years. So they have been learning Chinese. They're in the bilingual Chinese class that's now at the BB school, and they also participate in the Little Dragons after school program at BB. And we have really loved being able to participate in the Chinese Culture Connection programs. And we're very happy and very, very honored to give the talk today. Particularly, and I'm going to come back to this later, but I just want to say for now is, May, as many of you might know, she's a Tai Chi instructor, a Tai Chi teacher. And we're going to talk about Tai Chi because it has an important role to play in maintaining a healthy brain. But first, we're going to cover a number of topics because our goal really is to help people with mental health problems, right? Whether it be on the psychiatry side, I'm a psychiatrist, and so I treat people with depression, with anxiety, bipolar disorder, schizophrenia, panic, other kinds of disorders like that. And Liliana treats patients with dementia, stroke, headache, and conditions like that. All of these, you could say, are mental health problems. And we want to provide education and support not only for our patients, but for the invisible second patients. Who are the invisible second patients? They are the family. They are the relatives who help provide care for our patients and who often experience a lot of stress, a lot of difficulties due to some of the caregiving that they have to provide, although it can also be of benefit to them to be caregiving, to be helping a relative with a chronic illness, with a chronic mental health problem. And they can feel good about it and satisfaction. We want to encourage that. We want to help people to feel better and to help them preserve their memory. So that's what we're going to focus on. I would like to share with you that in order to do this better, we are running a research study that involves focus groups. A focus group means that 6 or 8 or 10 people come together on Zoom and give their opinion. So who doesn't like to give their opinion here? I would like to know if there's one person here who doesn't like to give their opinion. So we want your opinion, and we will pay you for it also. This is for people who are the relatives of those who have memory problems or might even have a diagnosis of dementia. And you can see there's an email address and there's a telephone number on the screen that you could contact to be involved in one of these focus groups. Right now, we're only set up to do the focus groups in English, although if there are enough people, perhaps we could try to do one in Chinese language. So, mental health problems are important because they reduce the quality of life, right? They bring unhappiness. They cause disability, meaning that they make functioning difficult. They worsen memory problems, and they are a risk for dementia. And for that reason, I want to tell you about 2 of the most common mental health problems before we talk about preserving your memory. Because if these are untreated, if you don't seek help from a medical professional, they can worsen your memory. So it's important for you to know about these. The first is depression. Depression, according to the World Health Organization, is the number one cause of disability in the entire world, more than any other condition, depression. Depression is more than 2 weeks of experiencing low mood, such as sadness or hopelessness, difficulty getting pleasure or joy, and some of these other symptoms, doesn't have to be all, but at least some of sleep difficulties, reduced interest or motivation to go out for activities, feelings of guilt and self-criticism, low appetite, difficulty focusing, for example, difficulty holding a conversation or reading, irritability in fighting, right? So getting mad very quickly at loved ones, and even suicidal thoughts, which can be thoughts like, I don't want to be around anymore, all the way up to plans to take one's own life. So these are all symptoms of depression. And if you're having any of these, or if your loved ones are, it's important to get them treated. Depression interferes with your ability to live normally and to function normally in relationships. Now, moving on to anxiety. What is severe anxiety? It's a constant worry in the head that's consuming. It causes insomnia. A person can't sleep because of their anxieties or wakes up in the middle of the night. They have difficulty relaxing. Even when they try to relax, the thoughts keep going, or they feel physically tense. There might be panic attacks. It might become too scary to leave the house and experience physical tension or mental tension. And again, this interferes with ability to function in relationships and with memory. All right. Now, in minority communities, when we think of minorities, we think of people who are non-white people, right? Depression can be viewed as a weakness, seen as a weakness. And people who are suffering from depression or even anxiety might report physical pain or sleep problems, because mental health problems can be seen as shameful to the family, that the family would lose face if someone knew that the person was suffering mentally. This is particularly important among older adult Asian American females in the US. So surprisingly, relative to other ethnicities, older adult Asian American females have a higher rate of suicide. Right? The Asian community in general is at lower risk, but among Asian American older adult females, they're actually at higher risk of suicide. So this is an important problem that we cannot ignore. It's really critical because there are effective treatments. There are effective treatments for depression and anxiety, right? These include talk therapy, one-on-one with a counselor or with a therapist. There are medications that are very good and have few side effects, low side effects, and very helpful. And in severe cases, of course, hospitalization for a short period of time might be required. So if you know someone who is not participating in social activities, they used to be around, but then they disappear. They've lost interest in hobbies. They're quite lonely. Maybe even they complain about physical pain a lot of the time. Reach out, ask how they're doing, advise them to talk to the doctor. And if you know someone who is talking about or contemplating suicide, there is actually a hotline for Chinese language people. And the telephone number is here, 877-990-8585. There's also an English language suicide hotline. You can read the number. And of course, a person can call 911, which I would only recommend in the setting of a very severe emergency, where someone is at high risk of getting hurt right away if there's no help that comes. All right, now we're going to move on. And I'd like to introduce Dr. Ramirez Gomez. And thank you for being with us, and just let me know when you'd like me to advance each slide.
Thank you. So I am a neurologist and I focus on the diseases of the brain that affect its structure and function, such as problems with memory loss, for example, Alzheimer's disease, vascular problems. Maybe some of you have heard about vascular dementia. And that's what I'm going to talk about, how to preserve a healthy brain and our cognitive functions, our memory, our language, our ability to interact and have a healthy life. Next. And again, as we are minority groups, and I am too, I am from South America, Colombia, I am a Latina, and here as we are talking to people who are Asian Americans, we are not white, so we're different because we come from different places, we have different backgrounds, different socio-economical and socio-cultural environments. And unfortunately, there are also differences in the care that we receive. And minorities in general tend to be underserved by the health system. What this means, for example, is that people that are Hispanic, Asians, Black, usually receive a diagnosis of cognitive decline or dementia later on in the disease process when the condition is more advanced. In other words, a white person it's more likely to be diagnosed at an early stage compared to someone from a minority background. And not only the diagnosis, but also the evaluation, to have a comprehensive evaluation, seek care from the doctor, it's different. Next. The most important question that I get, I am asked most of the time is, how can I preserve my memory? How can I keep my mind sharp and right as I get older? So it's important to understand what is normal aging, what happens as we get older, because some things happen and there are some changes. But where is that line when things are not normal? That we have to start thinking, maybe something is happening here and we need to ask for some help and see how we can get some treatment or get a diagnosis. We are also going to talk about what is Alzheimer's disease and dementia. People ask, what's Alzheimer? Is it the same that dementia? Is there any difference? And what can I do, if anything, to prevent or delay dementia? Next. So first of all, we are going to start talking about what happens as we get older. So as we get older, usually 50s, 60s, or later, 70s, 80s, people start having these moments that they sometimes refer as to senior moments. It's like, is this I'm getting older, or is this something more serious? Versus Alzheimer's disease. So for example, the tip of the tongue phenomena, when you want to say something and you don't remember, but you have it there and you have to think a little bit hard, and then it comes. Then you remember, but it took you a little bit of effort. Sometimes those are normal. The difference is how frequent they are. If that's something that is happening every single day, and then people start noticing and it holds off your conversation, then that may be a problem that you may need to have an evaluation for. But if it's once in a while, those things are normal and they could happen. That's the same with words. How do I call this? When we forget the name of something in particular, or sometimes even we forget the names of people that we knew, but then after a while we remember. But again, the problem is when this starts happening very often and it interferes with our conversations and our daily life. Other common examples include that we forget where we put our keys, and then we have to go all looking around, or when parking the car, sometimes we forget. It's also common when we go to one room and we say, oh, what is that I was going to get from here? And then we have to think again to remember. Those things are common, but again, the difference is how frequent are those happening. If this is a daily problem, and then family are calling on you and saying, Mom, Dad, this is happening a lot, how do you feel? Then it may be a problem if it's very frequent. But if it's infrequent, like once a week or once a month, then it may not be a problem. In any case, the conclusion here is that if you wonder, is this normal or not? What do I do here? It's always better to have an evaluation. So my advice to you is that if you have any question, is this normal or not? It's better to consult with the doctor. And in this case, it usually starts with your primary care doctor, who does the initial evaluation, and then they will refer you to a neurologist, who is a doctor of the brain, to conduct additional investigations if necessary. Next. Again, to summarize, so when do we worry? We worry when we start having memory loss that is not just those episodes of mild forgetfulness that I talked about before, but are remembering things that maybe happened yesterday. Or when you start asking repetitive questions, or when you start noticing, my mom already told that story twice today, or I already told her this and she's asking repetitively. She doesn't remember the answer I am giving her. That's something that's more serious and needs an evaluation. The same if someone is having difficulties with language. When we, for example, speak two languages, let's say you speak Mandarin or Cantonese as your first language and you learn some English, as someone starts having difficulties with language, it's frequent that they forget the use of the second language first. So they start having more difficulties with English. And then later on, they may start having more difficulties with their own original language that go beyond just difficulties finding names or words. If you get lost, or for example, driving goes to a different place and then it's not easy to find a way around, and this starts happening repetitively, that's a sign of concern too. Misplacing items, or as Dr. Jain mentioned before, having loss of initiative. For example, someone that was the life of the party, talkative, happy, always there, planning events, doing things, and then slowly, gradually, that person is not as interested, not planning as many things, not going to social events, not interested in attending things. That's also another point that you should get an evaluation for or talk to the doctor. Next. And here I'm going to answer the question of what's dementia and what's the difference between dementia and Alzheimer's. So dementia is a generic term, and what this refers to is to the loss of abilities to function independently in life. For example, you are able to pay your bills, go to places, plan activities, conduct your life in an independent way, but as someone starts losing those abilities, for example, because they are not able to remember, to plan, to pay the bills, or go to the grocery store, or cook, they need to depend on other people to help them. That's what we call dementia, when someone loses their abilities to function independently. Then dementia is caused by different diseases or conditions, and the most common one by far is Alzheimer's disease, but others, and usually one that is actually common in people of Asian heritage, is vascular dementia, that is associated with vascular risk factors, including history of stroke, hypertension, diabetes, smoking. And then there are other causes of dementia that are less frequent, that sometimes we call mixed or other types. Next. So dementia is an umbrella term. What this means is that dementia is just a generic name. We call dementia to any condition that cause someone to lose their abilities to function independently. And again, under that umbrella, we have Alzheimer's disease, vascular dementia, or other types. One example that I give to people is like having fever. You have fever. That's a name, it's generic, but what is causing that fever? Is it that I have a urinary infection or pneumonia or an infection of the skin? So that's the difference. That one is kind of the big name, generic, but the other one is more specific. It refers as to what's the cause of the problem. Next. So there is a continuum. It's not that someone all of a sudden rapidly loses all their abilities and one day was perfectly fine, and then in a week is not able to do anything by himself. It's more of a slowly progressive condition, and usually it's even difficult to pick up at the beginning because it's difficult to distinguish, is this normal or not, what's happening here. But as you see that the symptoms continue to progress, then you start realizing that something is happening here. And that's what the graph is showing, is a continuum. And the dotted line, what it shows is that that's a decline that goes from no having symptoms to having early symptoms. That's what we call preclinical, to MCI, which stands for mild cognitive impairment, is where those mild symptoms start to be noticeable and then slowly progress over the course of years to dementia. Next. So I'm going to stop here to give a positive point, which is that there are things we can do to modify a risk. You know, people always ask, what can I do? I don't want to get dementia. Is there anything I can do to change the risk? And the answer is yes. And here I want to point out to research that has shown that there are modifiable risk factors, things that we can intervene on to decrease the risk of dementia. And as you read at the bottom of that graph, There are things we can change and others we cannot. For example, if we are seniors now, we cannot change how much education we received when we were younger. If we completed elementary school or high school or graduate. But we can change other things which are highlighted there. Those include smoking is one of them that's in our power. We know smoking is not good, and this is not only for the lungs, also for the heart, also for the brain. People who smoke have a higher risk of dementia, specifically vascular dementia. So I encourage you respectfully to consider quitting smoking, reducing the amount of smoking. All that's good for your brain. Avoiding cigarette smoking. Next is physical inactivity. So I encourage you to exercise, go for walks, and as we are going to hear later on, do more physical activity. And depression, because as we already heard earlier today, there are treatments for that. So it's very important to seek help. Next.
Okay, thank you so much. So I'll describe the next several slides. And something that's really fascinating is that lifestyle can mean so much. In fact, if you have a poor lifestyle, and we'll talk about what that means, you have 2 to 3 times the risk of dementia than if you have a better lifestyle. So, what factors are helpful, right? And what factors are harmful? Well, these are some factors that reduce your brain's cognitive reserve. What does the reserve mean? The reserve means those capacities in our brain that enable us to compensate for when we have difficulty or when we have struggle. So for example, let's say you lose a map, right? You might still have some memory of it in your head, how you were going to get from one place to another. That's your reserve, okay? These are the things that reduce the reserve. If you have poor sleep hygiene, hygiene means a kind of cleanliness, you could say. We'll talk about specifics of sleep hygiene. If your nutrition is poor, and we'll talk about your diet. If you're in the very difficult position of having an addiction to substances or smoking, if you have a very sedentary lifestyle, which means that you're sitting a lot of the time, you're not active, you're not exercising. And also not getting the right medical care, not getting the right medical care for diabetes, for any heart conditions like high blood pressure, high cholesterol, not treating depression or anxiety. So these are important to be aware of, that these diminish your brain. I just muted myself. So can we increase our brain reserve? Well, fortunately we can. So I want to share with you a couple studies here. First, diet. Okay, here is the good. And JAMA here on the left, that stands for the Journal of the American Medical Association, which is one of our most well-respected scientific journals, okay? So in the good category are eating fruits, nuts, vegetables, whole grains, fish, and dairy. And on the other hand, the bad side are processed meats, refined grains, sugar-sweetened beverages, trans fats, such as in potato chips, also in all kinds of baked goods, anything with partially hydrogenated oils, having too high amounts of sodium, and drinking alcohol. Now, the whole alcohol issue is quite difficult. Certainly drinking too much alcohol, meaning more than 1 to 2 drinks on a daily basis, certainly that's quite bad, quite detrimental to your memory. Now, lower amounts of alcohol are also not great, but they're probably not that bad for you. And so what we advise or what we recommend for alcohol is if you're going to drink, drink on occasional social situations, perhaps 1 or 2 drinks, but not more, and not have it be a daily thing. Dairy is a very interesting issue because many of you may have heard in the newspapers or health advice that you should avoid high fat. But there have been many recent studies in the past 3 to 5 years that suggest that high fat dairy is not harmful. And in fact, it might be more protective than low fat dairy. And so we have here some specific studies within Chinese populations. So for example, the first one I've listed here, Chua and Talea, so 2 separate reports, studied Chinese population in Singapore and found higher dairy was associated with less dementia. And there are even some studies that look at particular chemicals within dairy and find that fermented dairy, so things like yogurt and cheeses, that those contain particularly protective molecules. Perhaps this is the newest science, but it's not always the final word. Nevertheless, it's encouraging for those of you who like dairy in your diet. Another study, very recent in Chinese people, found that eating legumes, vegetables, milk and dairy and nuts, but low levels of noodles and cereals, so that the balance is more on the legumes, vegetables, milk and dairy and nuts. Okay, they had less mild cognitive impairment and better language and memory function. Okay, there are similar findings from a Japanese cohort, but the summary of the evidence is we're not 100% sure. We're not 100% sure. But I think the fact that we're not 100% sure should be reassuring, because if we found any really clear extreme danger from these, we would know already. We would definitely know, the studies would be there. So I think it's safe to say, including an ample amount of dairy in your diet is safe and might even be beneficial for reducing your dementia risk. Now, here are the clearly risky foods, okay? These are the foods that might worsen your memory, particularly if you eat them on a regular basis, daily, multiple times a day. Red meat, sugary candy, sugary desserts, sugary beverages, other high sugar foods, really, really negative for the brain. And foods high in trans fats, these baked goods that have partially hydrogenated oils, or fried foods are often also high in trans fats. Fried foods can really contain a high number of these, and they're bad not only for the brain but also for the heart, because they make the blood vessels very, very tight into where the blood vessels can't move well appropriately. So those are very risky ones. So this has been published by Old Ways as the Asian Diet Pyramid. So this is a summary of what we've been talking about. So these are the good things in your diet that you should eat most regularly: whole grains, vegetables, fruits, nuts, beans, legumes, and then Fish and shellfish are also good, at least twice per week. Moderate amounts, meaning once a day or maybe once a week. Eggs, poultry, healthy cooking oils. Yogurt here, I think this was published in 2018 before these additional studies in dairy. I think yogurt can be moved down, to the fish level here. And then finally, meats and sweets should be less often. These should be reserved for special occasions. And then drink water and tea. So several epidemiological studies, meaning studies of populations that are large scale, have shown that drinking green tea, in particular, green tea is beneficial for extending longevity, and it also contains some molecules that may help protect the brain. But you don't want to drink green tea too late because it contains caffeine, and caffeine takes on average 6 hours just to get to half of the level that it had when you first drank it. Okay, so that means that if you drink a cup of tea at 4 p.m. with caffeine, at 10 p.m. at night, half of it is still in your system and affecting your brain and reducing your sleep. So for tea, we advise that you have your last drink of tea or any other caffeinated beverage or caffeinated food no later than 1 or 2 p.m. in the afternoon. All right, I'm going to pass it back to Dr. Ramirez Gomez.
We are going to continue talking about healthy habits that are important to promote a healthy brain, and these include sleep. Perhaps some of you have noticed that as we get older, it's likely that sometimes we tend to sleep less or maybe harder to sleep, and it could be that it's difficult to fall asleep, or we wake up too early, or we have an interrupted sleep, meaning that we have to wake up many times. Sometimes people have problems because they need to get up and use the restroom, go to the bathroom at night, or different situations. So what we are going to talk about is the importance of good sleep and a good amount of hours. Why is this? Because it turns out that while we sleep, actually the brain is working, and there are parts of the brain, specifically the cleanup system. Imagine that the garbage pickup comes at nighttime while you sleep. That's what happens with the brain, specifically with the proteins that are not good, the ones that are bad, and accumulate in the brain. They are being cleaned at night as we sleep. And that's the reason it's important, because we need to have that restorative sleep so the brain can be cleaned up. That's, like an example of how to explain this, but it's true. There is a lymphatic system that gets rid of the proteins at night as we sleep. So it's very important that we take care of our sleep if we understand why we need it, not only to feel very rested in the morning, have a lot of energy to go do all the things, all the healthy behaviors we are talking about today, but also so we can get rid of these bad proteins that tend to accumulate in the brain and cause disease. And for that, it's very important to have a good sleep hygiene. What this means is that we have to have a good routine that would allow us to go to bed at the same time every night, wake up as much as we can regularly at the same time every day, and have a total amount of hours of sleep be good and consistent. So as it's pointed in the table there, the amount of sleep that a person needs varies depending on their age. So let's say about 61 to 64, you need 7 to 9 hours. Older than 65, about 7 to 8. So in general, the amount of sleep that everybody needs is different, because there are people that tend to be good sleepers and they sleep perhaps too much, and others that all their life has sleep 6 hours. So this is a generalization, but it's very important. And sometimes people take naps too. Those count for the total amount of hours of sleep, but I would say that taking a nap, it's only good if you have a good night of sleep at nighttime. If you take a nap during the day, but then you are not able to fall asleep on time, you stay awake past midnight and then you cannot fall asleep, then naps are not recommended. It's better that you stay awake all day and save all your sleep for nighttime. So be consistent. Try to have a routine. Don't look at your cell phone or at screens at least an hour before you're planning to go to bed. Turn off all images. And also, get exercise during the day. It's good to be physically active. Make sure your bedroom is dark and quiet and cold, no too hot. It's good to keep a temperature that is a little bit on the cooler side because you tend to sleep better. Remove electronic devices. I know so many people tend to sleep watching TV or listening to the radio. It's better if you try to stick to a routine in which you are able to unplug all electronics an hour before you go to bed. Avoid eating large meals just right before going to bed or drinking caffeine, coffee, sodas that have caffeine, or green tea in the afternoon. And also talk to your doctor if you have issues with your sleep, because it's important to take care of the sleep issues. For example, obstructive sleep apnea, which is a disorder of the sleep when people snore at night time and they wake up sometimes gasping for air. It's important to be treated for, because there is treatment. There are machines that one can use at night to help them breathe better and get good oxygen to their brain. So if you have any questions about sleep difficulties, it's better to talk to your doctor because sleep is very important. Next. Also, it's good that you take a look at the medications that you're taking, because sometimes we do have a lot of medications in our cabinet, including, for example, sleeping aids, those medications that you take when you cannot sleep. And actually, it turns out that some of them could be detrimental for your memory. The reason is that they are sedatives. They kind of slow down your brain and make you too sleepy or groggy the next day. And over time, they cause cognitive changes too. So it's important, for example, medications such as Benadryl, or these ones that they sell at the pharmacy that are for dizziness or sedatives. It's not good to take on a regular basis. Also, if you take a medication for your sleep, it's good to consult with your doctor. What type of medication is that? Is one that would interfere with my memory, or is one that is safe? Because there are different types. So that's the reason we have there one example. Talk about your prescription medications, because some of them can also slow down your brain, your memory, and can cause fogginess. Again, there are also other habits, such as smoking, or people that smoke marijuana or use other drugs. Those too can have detrimental effects for your memory and your cognitive abilities. So it's important to go through the list and look at which ones you are taking and discuss with your doctor which ones are safe and which ones are not. Next. The same thing comes with vitamins. And again, in my memory clinic, this is a question that people ask me a lot. Because when you go to the pharmacy, you see an entire shelf of medications that are being promised and advertised as boosters for your memory, cognitive enhancers. And the truth is that scientific evidence has not backed up those claims. So sometimes it's more of a marketing strategy rather than real science. So what's important here is to have a healthy diet, have a healthy nutrition, as Dr. Jain explained earlier, and consult with your doctor, because we are able to check blood levels of important vitamins, for example, vitamin B12 that affect memory. And if there is a deficiency, your doctor is able to guide you how much and how frequent you need to take them. But other medications or over-the-counter vitamins or products that are advertised sometimes on TV or on the internet are not sufficiently backed up by scientific evidence that they are really doing what they are promising to. So use with caution, not only because of course you're spending your money when you buy them, but also some of them could have other side effects that may not be as safe. Next.
All right, thank you so much, Dr. Ramirez. So, and I noticed that there are some questions popping up, which we'll get to at the end. Now, I'd like to talk to you about some of the other important factors that we can do to help preserve our memory. So there's an epidemic of loneliness in society, in part caused by the COVID-19 pandemic and the difficulty with getting together with family members in person and friends and travel. And in part due to, particularly within American society, the fact that there's so much mobility and people travel far away from their families. For example, kids traveling away from the parents and from those cities, which it can be a good thing, that travel, but this can also be a consequence of it. And if loneliness is a consequence, that can be a problem. There's, for example, this study by Zhao and colleagues in 2016 specifically looked at a sample of hundreds of Chinese people. And Chinese people who were lonely had a higher chance of developing dementia. And men were even more at risk from this than were women. And loneliness is being studied scientifically for what molecules in the body it changes. And it's clear that there are biological effects of social loneliness. So be intellectual, be social. There are many activities that you can do that are social and cognitive to help your brain. You can use these to help challenge your brain to preserve your memory and to preserve the speed at which you think and talk and move. These are things like learning new skills. You know, there's this saying in English, but it's a myth, it's not true, okay? And the saying is, you can't teach an old dog new tricks. I don't know if you have the same saying in Chinese, but in English, it's a saying that suggests that if you get older, you can't learn anything new, you should just stop. But it's really not true. There's clear evidence that there's neuroplasticity, meaning the brain continues to be able to remodel and to learn new things, even as you're getting older. And so learn new skills, stay active in the community, social groups, participation in social groups like at the Chinese Culture Connection can be helpful. Also, religious groups can be helpful if you have religious or spiritual beliefs, or other kinds of social organizations. And keep in touch with loved ones. Live communication is best. In person is best, but if that's not possible, then calling on the phone and talking, or virtual FaceTime is better than texting. You know, that texting back and forth is not quite as positive for the brain, even though if it's all you have, then use it, absolutely. So activity in both mid and late life. Midlife is 40 to 60 years old. Late life is over 60, have been shown to have protective effects. And here are a number of examples that you can use: doing puzzles and games, reading books, newspapers, and magazines, learning by taking art classes, dance classes, continuing education, crafting, right? Socializing, and doing community activities, including volunteering, attending concerts, trying new restaurants. All of these are very helpful for the brain. All right, next, exercise. Exercise. Get your heart pumping, right? This is one of the most important things, right? Because many people ask, you know, I'm having problems with my memory. Can this improve? Or am I just gonna keep where I am or just go down? But can my memory actually improve? And there are actually several studies of physical activity that show that regular cardiovascular exercise, and I'll tell you what that means, 3 or more times a week, is associated with lower risk of progressing from that mild cognitive impairment stage, or MCI, that Dr. Ramirez was talking about, to dementia. And also that improving fitness has been shown to actually boost memory and to boost daily functioning in patients with dementia and in patients who have mild cognitive impairment, who are noticing the beginnings of these memory problems. They improve global cognition, improve executive function, meaning your ability to plan and organize and remember what you were trying to do when you went from one room to the other room, and improve attention for patients. So reverse some of the memory loss. Okay, so what does this mean for physical activity? At least 7,000 steps per day. If you don't have a fitness tracker, you can get one. For example, a Fitbit, you can get a good one for less than $100, or a Garmin, and then you can track, are you walking enough? Are you getting enough steps? Get up and move each hour. Take 5-minute breaks to walk around, particularly if you work, if you sit at a desk all day long. Get up every hour for 5 minutes and move. It's very important. And in terms of aerobic or cardiovascular exercise, the recommendation is 150 minutes to 300 minutes a week of moderate intensity. Okay, and what moderate intensity means is that you notice a little bit of, like your breathing, it's a little bit more difficult to get as much air, but you can still say some sentences. You can still talk and say some sentences. Or half of that amount, 75 minutes to 150 minutes a week of vigorous intensity, aerobic physical activity, meaning you're exercising to the extent, for example, running or jogging or cycling or swimming, to the extent that you cannot say a full sentence. You can only say a couple words, you know, where you really feel your heart pounding. Okay, so these are the physical activity recommendations. And finally, this helps prevent injury when you age, and it helps prevent falls. And that's muscle strengthening activities on 2 or more days a week. Doesn't have to be in the gym, doesn't have to be lifting weights like this is showing, but it should be strengthening activities, core muscle strengthening activities, push-ups, other kinds of activities that are focused on improving your muscular strength. All right, next one is going to be lowering your stress levels. So this one's a subject that's very close to me because it's the subject of my research, which is in some of these topics. So how is stress harmful? Well, high levels of stress leads to chronic, meaning continuous, activation of the body's stress response, the release of hormones such as cortisol and epinephrine or adrenaline that course throughout your body, from your brain throughout your body. And they increase your blood pressure, they increase your risk of heart disease, they worsen your immune function, and they even have detrimental or poor effects directly on your brain cells, on your brain cells' ability to metabolize or use energy, on your brain cells' plasticity, meaning its ability to reshape when you learn, and even on the brain cells' survival. Okay, and this can result in cognitive, meaning memory types of symptoms, and behavioral symptoms like lower motivation, lower energy levels, things like that. So what you can do to help ameliorate stress, mindfulness training, and I'll say a little more about this, emphasizes focusing on the present moment to reduce stress and anxiety. And you can learn this like with an exercise like Tai Chi, or you can learn this with a meditation teacher, or using a mobile application or even computer program. If you look up that word mindfulness online, you'll find many exercises, including in Chinese. And some of the techniques to help reduce stress include meditation, which means kind of sitting mindfully for a long period of time. We're doing breathing exercises or physical relaxation like stretching. And just like with aerobic exercise, there is a pilot study of mindfulness training in older adults who have difficulty with their memories, subjective cognitive complaints. This shows increase in memory and brain volume from doing these practices. And for Tai Chi in particular, a meta-analysis is a study of studies. It means that there have been several studies in the scientific literature, and they look to see what's a common effect, right? Is it good? Is it bad? Or we don't have enough evidence. And there's a common effect showing an increase in cognitive function across many studies for Tai Chi. And Tai Chi also reduces risk of falls with aging because of its focus on balance. So it's really quite helpful. Here are a few more words on mindfulness. Mindfulness comes from Buddhism, but in clinical practice, we don't need to have it focus on Buddhism. It can just be an adaptation that's not religious. And it involves remembering in the moment what you're experiencing, what your experience is, and its impact on you. And so you're paying attention to the moment non-judgmentally. You're not saying, oh, it's bad, it's good, it's horrible, it's this. You're really just trying to focus on what is. And you try to understand its impact on you, not judging it as good or bad, but just, okay, this is what's happening. And I'm going to open myself to it and be curious about it and notice my breathing. I'm going to notice my thoughts. I'm going to notice my emotions. And instead of reacting to them, I'm going to maintain an attitude of observing, of noticing the rise and the fall, how they pass, how all of these different mental phenomena pass. And mindfulness is built into ancient Chinese practices of Tai Chi, of Qigong, of ancient Indian practices such as of yoga, right? And so here we see, Tai Chi is such a great thing because it's also social, right? People are coordinated and doing the social, gentle movement together. So it can really be helpful, the slow, intentional, mindful movement. So we've covered a lot of ground in terms of healthy behaviors, everything from diet to sleep, to exercise, to socializing, to keeping healthy, and also getting appropriate treatment for medical concerns and for mental health concerns, such as depression, such as anxiety. And we believe that if you shift your lifestyle to a healthy lifestyle, you can significantly reduce your risk of getting dementia over time, but also even improve your cognitive function above where it is today if you follow some of these recommendations. So I'm going to stop there, and we have time for questions. So thank you very much for your attention. We'll open it up.
Thank you. So right now there is many questions in our chat and Q&A session. May, would you like to read the questions to Dr. Jain and
Yes,
Liliana?
yes. The first one that we saw was the person asked about 2 hours of sleep in the PM is good. I assume that's meaning at night. What do you think about 2 hours sleep at night?
So I will answer that about sleep. You know how much sleep a person needs. So it's good to have 7 to 9 hours. That's an average total of amount of sleep during the day. Sometimes people do feel that they need to take a nap, usually early afternoon after lunchtime to get refreshed. It is okay to take a short one, about 20 to 40 minutes. What happens is that sometimes when people take a nap, if it is too long, then they are not able to fall asleep at nighttime. Then they stay awake until later, sometimes past midnight, and that's not healthy. So if that's a problem, the recommendation is to avoid taking a nap or taking a shorter one, just like 20 minutes, 20 to 40, and wake up. And then try to go to bed regularly at the same time every night and wake up at a consistent hour in the morning. And someone asked about coffee. I'll link it because it has to do with sleep too. Someone asked if drinking coffee is good or bad for your brain. So there are studies too that have shown actually that coffee is good. Coffee is not bad. Actually, there have been some studies that have shown that people who drink more coffee have less risk of Parkinson's. The problem with coffee is that you don't want to take caffeine past, let's say, noon time. A cup of coffee in the morning or tea is good. But when you drink it later on, like past 2, 3 p.m., we discuss how it lingers in your body and then it keeps you awake at nighttime. So that's the reason it is healthy, but if you drink it in the morning and you limit your amount of caffeine intake.
Great, yes, 8 to 9 hours. That's kind of luxurious. Depends on what kind of time. But I think it's good, important to preserve our health. So there's another question called, my father is 93 years old and he sleeps about 12 hours. Is this normal? Would that, he also want to sleep at any other time, any chance that he has? So is that considered normal?
Yeah, so that's something actually that happens as we get older, that sometimes people do want to sleep more, but it does become a problem. Here is how we say it. Usually, it's good if you sleep your good amount of hours at nighttime. And during the day, it's natural to try to fall asleep if you feel bored, if you are not stimulated, if there is not much going on in the environment. So the recommendation here is try to structure the day and have a routine. Let's say wake up time is 8:30 or 9, breakfast, take a bath or put on new clothes and get going with the day, and then structure activities. For example, playing games in the afternoon or reading or having a conversation. Try to engage, because otherwise it would be natural that the person feels bored sitting on a chair watching TV, they would fall asleep. So here the recommendation, the message is try to keep them busy, doing something during the day. And I know it requires effort and energy because you are busy and you just want to do your things, but that's when we need help. from other family members or the senior center, or get them sign up into activities so they don't get bored.
Also, it is possible because when you get older and you have a fewer people to be engaged with you, all other younger people are busy, and so they are alone. They can't really have no activity to engage with, and so that makes them even feel more likely to fall asleep.
Yes.
Yes. There's a question said, well, yeah, that's my question. Say, would learning a new language help also improve our memory?
Yes, it definitely will help you to improve your memory. Learning a new language involves activating multiple brain systems, and you learn so much different, you challenge your brain in so many different ways when you're learning a new language, from words to articulation to even perception of hearing. And one thing that I'd like to mention on hearing is that it's also important, if you're aging and you notice hearing loss, to get tested and to get hearing aids. Hearing aids are one of the things that can also help reduce your risk of memory problems, because it keeps the brain active, and you'll need it for learning your new language. So learn the new language with your hearing aids.
That's great. That's great. Yes, it's so important. Without able to listen, that you won't be able to learn.
Yeah.
There's one person asked about what about singing? Singing has any brain and memory health connection?
So singing is very important, and it's important for many reasons. One is that song and music is an antidepressant, you could say. It's not for everybody, but for many people, it helps them. It helps them to make their day better and less stressful. So I'm not aware of any particular scientific studies on singing and memory health, but nevertheless, it makes good sense. And it makes good sense because when you're singing, you're with other people, or you're connecting with others in some way. And even if not, you're using a different part of your brain from just normal words. You're using the temporal lobes that are on the sides of the brain that help you to be able to sing. So I recommend, for mental health and also for overall brain health, to sing as much as you can. Incorporate music into your life. If you can, participate with others with music. Yeah, I think it's so beneficial.
And I also want to add that actually in people that are already experiencing cognitive changes like memory loss, cognitive decline, listening to music and those good memories of things when they were younger, it helps boosting up their mood, making them feel more comfortable, at home, at peace. So sometimes, at times when they are agitated or angry or something seems like a discomfort, it's good to remember and try to find music that they enjoy. It could be way back, things that bring them good memories. And also, not only for the person that has difficulties with memory, but also for the person that is caring for them. There are studies of chorus, people that sing in choral, that it helps with their mood and their good attitude and relieves some stress. So I think overall, it's a great idea, music in any form. It could be singing, or it could also learning an instrument. That's also good for the brain to create connections and engage all those activities and loves that would help you stay healthier and engaged and active.
Wow, yes, actually, I agree totally. Particularly when one is really engaging in music, that in itself really brings up joy. And so when you are feeling connecting with joy, so you also bring the joy to others. So whoever surrounded you with that mood definitely will promote, not only your health, but also the relationship with the rest of others. I don't know if there are any other questions. I think one question I have posed is that earlier time that you have mentioned about how diet really improve our health and certain diets. Would you recommend, looking at the chart that you have mentioned, the red meat is considered not very healthy. And so would you recommend being like a vegetarian or be much more like a plant-based? I remember seeing the...
I think, yes, well, there's no question that overall a vegetarian or plant-based diet makes it easier to be healthy. Now, that being said, consumption of fish and dairy has been associated in some studies with, with reducing the incidence. So fish and dairy are not considered bad at this time. But having a plant-based diet, even if it's not 100% vegetarian, but a plant-based diet is very good. And I see in terms of the time to have dinner to be considered healthy, it really does depend on what your digestion is like. So for some people, if they eat too late, they have acid reflux, particularly in their sleep, that disturbs their sleep, or they have indigestion in their sleep and then they wake up. And so if that's the case, it's better to eat earlier, to eat, 5 or 6 o'clock, if normally they would eat at 7 or 8 o'clock, and certainly also to reduce sweets. So to reduce ice cream at night or other desserts at night, that would be very good. May, I do see some questions in the Q&A. I don't know if you'd like.
Oh, yeah, I did not really see that. Yes, actually, there are so many questions. Very good. All right. So the one is that, is drinking coffee good to the brain?
Yeah, so okay, we got that one. Dr. Ramirez had said that, yes, there's actually evidence that drinking coffee can be good for the brain, but only if you drink it before about noon and no later than 2 p.m. because it takes about 6 hours on average for it even to the caffeine to go down by 50% in your system. Okay.
Great. I think that one that we responded to is 93 years old. Okay. The next one is my dad can walk 100 steps per day and 100 hand press. And what other exercise, physical activities would you recommend for a 93 years old?
Yeah, very good question. Very, very good question. So first of all, 100 steps per day would be about walking from one's bed to the bathroom and back a couple times. It's very, very small amount of that. So it would be helpful perhaps even to see a physical therapist to be able to do more steps than that. And because walking, if the person doesn't have a specific injury or condition that requires them to be in a wheelchair, then walking is one of the most beneficial forms of exercise. In addition to hand presses, other core muscle exercises that activate the long abdominal muscles and that improve balance can be beneficial. And then also Qigong exercises are very gentle, very appropriate for a 93-year-old and can help him to focus also on mindfulness. So those are some I would recommend, but consider meeting with a physical therapist and getting in-depth advice and specific exercises.
Great. And also, he was asking, would you recommend dairy food products such as cheese and yogurt, less milk, or organic dairy food is preferred?
So the question about which form of dairy is best, I think it's an open one from the scientific perspective. The most important message here is do not feel bad about your dairy consumption. You know, if you like to drink milk, don't feel bad about that. And it's even okay to drink whole milk. If you like to eat cheese or yogurt, that's beneficial. And it's beneficial to have a varied diet meaning different types of dairy, because each one has its own set of chemicals that within these studies I was telling you about in the Chinese populations, really it was any form of whole fat dairy seems to be helpful. In terms of organic dairy food, I think that is somewhat dependent on someone's personal, philosophical, and ethical beliefs. From the nutritional standpoint, there are not a lot of differences just in terms of pure nutrition between organic and non-organic. Or from the brain health standpoint, there are not a lot of differences, but organic food can be much more costly. So I think it depends a lot on one's budget, also on one's ethics. I mean, if you can obtain grass-fed milk and grass-fed cheese from cows, you know, that's the nicest for the cows. But from the brain health standpoint, don't worry too much about it.
Very good.
Yeah.
And also in terms of, you know, there are a lot of Asian population or Chinese that they have a dairy intolerance. What would be any substitute for it?
Sure. So it's so we're not saying you have to eat dairy. Okay. The most important thing is the vegetables, beans, and the fruits, nuts, and whole grains. And so dairy, it's not required. You know, fish is also very good. And the important thing is to avoid red meat and to avoid artificially sweetened foods and to avoid trans fats like in fried foods. So if you can avoid the bad things and you can have a varied diet for the things your body is naturally able to digest, then you're going to be in the best position and you're really going to set yourself up for good health.
That's wonderful. I mean, those the recommendation that you have offered to us is like accessible, and it's our everyday experience. So it's not like you have to really spend too much time or money to acquire. So this is a fantastic. Thank you so much. I don't know if there are any other questions. So this is the last chance. I don't see anyone else. Anyone else has any more questions?
So then maybe I can say, because I saw that there were some people who joined us over the course of time, maybe I can tell them about the study again.
Oh, sure, definitely. Yes,
okay.
Yes.
Wonderful.
Please,
so
can you show the PPT? I mean,
yes, let me in fact, I can put this into the chat. Okay. So what we are doing right now is we want to better for our research. It's very important that we get your opinions. Okay, so you know, who here on this call doesn't like sharing your opinion? You know, if there's someone who doesn't like sharing your opinion, then, you know, raise your hand and tell me. But most people like sharing their opinion, right? And we will pay people to share their opinion because it's so important for us. It's so important for us to get the perspective of a diverse community. So I have put into the chat, although I think it only went, let me put it in for everyone. I only sent it to the panelists. So this is, and I'm gonna share my screen and I'm gonna bring this flyer up, because what we want to do, I think we said at the beginning, we want to really help people who are not only our patients, right? Our patients are suffering, of course, but we also want to help their family members and their relatives who help them. Okay, we want to support them with new technologies and new technology resources. And so if you know anybody who's caring for a family member who has memory problems, please let them know that they're eligible to participate in our research study that includes focus groups. And so a group of people together on Zoom, just like this on Zoom, where we talk with each other about your preferences for mobile technology. And for each focus group you participate in, we're able to compensate you $30 for your time. And so if you participate in 6 of those with us, then the compensation can be up to $180. So the telephone number and the email for the person is here. And we're very eager to have more participation from people in the Asian community so that whatever we develop, right? We have grants. We have grants now from the Alzheimer's Association. We also have grants from the National Institutes of Health. And we want to make sure that what we're doing reaches and serves people in the Asian community. But we can't determine that unless we have your input. So please participate with us. We'd be really honored to have your participation.
Yes, actually, there's one question about, we sent out, Eva sent out a survey. That survey is only for the program that we present today, for your input to say, what do you think about the presentation today? What did you learn? Do you have any recommendation? Which, if you have any interest in learning more, I mean, I particularly requested to say that this is going to be a very general introduction. I'm sure there will be more learning to come, but of course we wanted to make sure that everyone can take it and can feel comfortable to relate to it. If you have any interest to learn more, please let us know, so we will be able to request more presentation from both incredible doctors. How wonderful we have in terms of the great opportunity for our 2 doctors that live in Malden, and they are just so busy, and yet they took their precious time to prepare this presentation and to help us, to educate us about how we can help ourselves to be healthier, particularly in preserving our brain memories. So we are very grateful for your participation, and of course we are very grateful for Dr. Jain and Dr. Let me pronounce this one more time. Can you help me to do it?
Ramirez.
Ramirez Gomez. So you have 2 last names.
Yeah, in Latin America, it's 2 last names. So Ramirez Gomez.
Ramirez Gomez. Great, thank you. I have to repeat this. The next time, I'll make sure I pronounce it correctly. Very good. So any other last call in terms of questions? And again, this is an incredible research opportunity for this focus group. So I encourage anyone who have an interest in terms of not only for yourself, or you have relatives or friends or family, or you are a caregiver who experience, have like this kind of contact with someone who experience memory loss. So this will be a great opportunity for you to learn and also share about your experience and how that we can gather more information and more research to this particular situation that we, modern life, somehow, I never really know much about this Alzheimer's disease until the last 10 years. I think in the past, there was not much of such a thing. Do you know, is there anything that really trigger that this has become a modern disease?
I'm sorry, that dementia has become a modern disease?
Yes, not necessarily happened 20 years ago or
sure.
anything like that. Yeah. So is that?
So the biggest risk factor for dementia is age. And so we have been a successful human race in improving our lifespan with clean water, with antibiotics, with treatments for other health conditions. And so we're living longer. And because we're living longer, we're getting more dementia. So I think that's the most important factor. The good news, though, is that we can substantially lower our risk of getting dementia with lifestyle changes. So that's the good news. Dr. Ramirez, do you have anything you want to add to that?
Yeah, so to conclude, I also want to remind everybody that these lifestyle changes, we don't wait to be too old. We start now. Because now, at this moment, any moment, however old you are, the earlier you do it, the better. So I encourage everybody to be healthy, take good care of their mind, their body, their spirit, their heart, and be active in any possible way. And thank you for having us here.
Thank you so much. That's so true. I mean, lifestyle is really number one basic, maintenance that starts from when your body is new, right? You don't want to wait until when you're old, your car is gone. Need to have a lot of repair to protect this account too late. So again, thank you so much. We did a wonderful timing, and I also want to take this opportunity to thank also Dr. Yongqi Song, who helped us to do the translation. He also has some study in this particular area as well, so that's why he has feel comfortable to help to translate.
Oh, thank you so much. Nice to meet you. Yeah.
We are very shy in pronouncing your name, so we almost nameless. So thank you again, Dr. Jain and Dr. Gomez.
Thank you so much, May. Thank you for having us, and thank you for all the work of the Chinese Culture Connection here in Malden. It really is important.
Yes, and thank you so much for entrusting your wonderful two children with us. I cannot believe you. What kind of language do you speak at home?
We speak Spanish at home and also English at home.
Wow, and now your children also speak Chinese, so
right. Yeah.
they are in a good hands. Very wonderful.
It's a constant effort. We have to tell them, okay, you're going to speak Spanish at dinner or you get a timeout. So we have to take the effort, right, to help teach our children.
Definitely, and that's the routine that you help to set up, so they know that what kind of a situation where they have an opportunity to practice what language, and so ultimately, they're going to be winners. Right. Because now you invest the time and effort to help them, and then they're going to feel part of their lifestyle, and then when they grow up, they can use it just like that.
Right. Yeah.
Yeah. Wonderful. Thank you so much. You guys are wonderful role model for all of us. Not only
thank you.
For the parents, of course, have been a great doctor. So thank you again, and we hope to see you soon.
Hope to see you soon. Okay.
Yes. Thank you.
Take care. Bye-bye.
Bye-bye.